Hey everybody, Professor H here. In this video, we're going to take a look at the time of life called middle adulthood. It's a really good time. That's where I happen to be. So stay tuned and we will take a look at this period of life. On our first slide, we see some images of individuals in the middle adulthood period. The first one is this gentleman who seems to be holding his head in his hands. I can totally relate to that. Maybe having a headache, maybe a little stressed out at work. The next image below is an older couple that are looking at something, maybe reminiscing. Maybe they bought a ticket to a cruise ship. Who knows? They did something fun there. They're laughing and smiling. Up in the upper corner here, we have an lady in middle adulthood who is maybe hiking with her grandkids and taking a look at the scenery. And down below, we have a lady in middle adulthood who is holding some books, appears to be in a library. Maybe she is someone's professor. How would we define middle adulthood? Well, we're going to take a look first at physical development, specifically physical changes that we go through in middle adulthood. And we're going to take a look at health and disease in middle adulthood. We'll start off by taking a look at some of the more visible signs that we are aging, some of those really noticeable signs that we are actually in middle adulthood. One of those signs is wrinkling skin and kind of sagging skin. Your skin in middle adulthood kind of starts to lose some of its elasticity, and some of the fatty layers and stuff that are positive types of fat that are underneath your skin that help it be stretched taut and firm start to lose integrity. You also, during middle adulthood, can start having something called age spots. Those are little hyperpigmented areas of skin that are dark. In other words, the pigment is is what makes your skin have color, and so a hyperpigmented area is an area that has a dark spot. You also will have graying hair. This is something that is pretty much unavoidable by this period of life. The only way to correct that situation is if you feel like coloring your hair. And in just a few minutes, we're going to talk about a double standard of aging when it comes to kind of differences between how women respond to this aging process and how men respond to it. On the image of the lady up in the top part of the screen, you'll see a lady with some writing on her face. It appears that there's a plastic surgeon that is making some markings so that she can have a facelift, which is one way that women sometimes choose to recover some of their youth in some way. Height and weight is another area that is kind of visible during middle adulthood where we see changes. A person in middle adulthood can lose up to 2 inches of height due to bone loss and a loss of some of the muscling, and we'll talk about that more later. You also will have a higher proportion of body fat when you reach middle adulthood. We talked earlier about how the metabolism starts to slow down in young adulthood, and by the time you reach middle adulthood, the brakes have slammed on pretty good on your metabolism. So if you're still eating the same amount of food, you would have to exercise a whole lot more to burn off those calories, because unfortunately your body tends to be a little bit more efficient in storing that fat when you get to middle adulthood. In addition, there's an increasing rate of obesity during this stage of development. And once again, that is partially due to your metabolism slowing down, yet your physical activity declining and the amount of food intake being the same. As I mentioned previously, there is a double standard of aging. And what I mean by that is that society tends to view men and women a little bit differently when it comes to our normal signs of aging, especially what we start to see in middle adulthood. For example, men are rated more positively when they have gray hair and when they are aging than women. Women have a tendency to be viewed more negatively in our particular culture. There is possibly an evolutionary route to this, meaning that men might be naturally attracted to women who seem younger without the gray hair, without the extra fat, because they might be more in that childbearing age period of life that would make them more attractive. So that's kind of the evolutionary perspective on this. And then our media and social messaging also has a tendency to value the young a lot more than the old. This particular double standard of aging tends to be declining somewhat. Sadly for men, they seem to be responding somewhat more negatively to aging than they had in the past. Part of that physical decline that I mentioned in middle adulthood has to do with changes in your strength, joints, and bones. There's a condition called sarcopenia, which is age-related loss of muscle mass and strength. 1 to 2% of muscle loss per year after the age of 50. And joint stiffness and difficulty in movement is also something that we see in Western cultures. In cultures that are more active, people that exercise more and maintain a healthy weight and active lifestyle, they do not see as much loss as somebody who has a more sedentary lifestyle. Osteoporosis is another problem that we see in middle adulthood. This is where it is a bone loss that occurs. It is an age-related bone loss. 40% of postmenopausal women experience this. Now, postmenopausal means that that woman is no longer menstruating. They have gone through the process of menopause, and we'll be talking about that as well later. And once a woman goes through menopause, they have trouble absorbing calcium from their diet anymore, which leads to bone loss. Men also can experience osteoporosis, but it is a much lower percentage of men that experience bone loss due to osteoporosis. I want to talk a little bit more about osteoporosis. With osteoporosis, bones become thin and brittle, and it is a period of rapid calcium depletion. Estrogen loss increases the risk for women. Estrogen has a tendency to be protective, and that loss of estrogen, once again, also affects it maybe indirectly affects the absorption of calcium. Genetics play a role in the risk for osteoporosis. We tend to see it running in families, and lifestyle can have a very big effect. One of the things that can counteract osteoporosis is weight training. When women come into middle adulthood with very strong muscles and do at least light resistance training of some sort, it can help combat osteoporosis by maintaining muscle and bone strength. Lifestyle has an effect. Once again, people who are more active and eat more healthy will have less risk for osteoporosis. Off and on throughout our developmental coursework, we have talked about difficulties with sleep or sleep patterns and how sleep patterns change with age. Now, in middle adulthood, sleep problems are common. And as our slide says here, they're common after the age of 40. Oftentimes, what occurs during this period of life is that people wake up in the night and then have difficulty falling back asleep. There are a lot of different reasons why this can occur, but this is one of the most common sleep problems during this period of time. Other problems can lead to difficulties with sleep, such as menopause. When women go through menopause, oftentimes in the United States or certain Western cultures, women who go through menopause experience difficulty sleeping. They experience hot flashes and other types of sleep disturbances. And men in middle adulthood have a tendency to be prone towards enlarged prostate glands, which cause them to have frequent urination during the night. Oftentimes, even if the adult in middle adulthood is getting, say, 7 or 8 hours of sleep, they may not be getting enough deep sleep. Deep sleep has been linked to protecting people from neurofibrillary tangles and amyloid plaques. These are things that occur in our brain that can cause problems later. They are markers for Alzheimer's disease. So basically, not to be an alarmist or anything, these things, if you don't get enough sleep, you're not automatically going to have these things occur. We just have seen studies that indicate that people who are lacking deep sleep are more likely to develop neurofibrillary tangles and amyloid plaques, which are flaws or things that occur in the brain that are associated with Alzheimer's. And I linked the study down below here. Some other issues that we see in middle adulthood is something called presbyopia, which is can be termed like old eyes. When you reach middle adulthood, your lenses lose the ability to adjust to objects at various distances. And oftentimes we have difficult seeing in low light once we reach this stage of development. The transparency of our lens in our eye also can be affected. It can be slightly yellowed, which is causing us to have difficulty in low light. So oftentimes, by the time somebody reaches middle adulthood, even if they've had great eyes all along, they may need reading glasses at this stage. Also, presbycusis, old hearing. Basically, what happens in middle adulthood is we start to see difficulties with hearing. It may not be things that are extremely noticeable. For example, I have hearing loss in my left ear. I can notice it if I put earbuds on. One time I thought my earbuds were failing and that there was a problem with my earbuds, and lo and behold, it was actually my ear that was the problem. I've reached that stage where I had to go into the doctor, have them do the ear test, and they're like, yep, you're losing some hearing in that ear. This adult onset hearing loss affects 50% of individuals over the age of 50. This occurs due to structures inside the ear becoming less flexible. You have many small structures inside your ear that need to flex and vibrate in order for you to hear well. And just like with the loss of flexibility of the lens in your eyes, these structures lose a little bit of flexibility as well. In addition, there's a small hair-like structures in your ear called cilia that pick up the vibrations, and those vibrations are what are going to send the signal to your brain. And these cilia kind of die off over time. Now, in developed countries, we see a lot more hearing loss and a lot more vision issues than we do in developing countries. Part of this is because with our hearing, if we are exposed to loud sounds, for example, men who are working heavy machinery or working with loud equipment, they have a tendency to have more pronounced hearing loss than women who have not experienced those same things. And in Western cultures, we do a lot of reading, a lot of eye strain, which causes us to have more difficulty with our eyes in middle adulthood than a culture that is not staring at a screen or a book or papers for an extended period of time. Another physical change that we see in middle adulthood is called climacteric. This is the midlife transition in which fertility declines. This occurs for men and for women. However, in females, it is a dramatic drop in estrogen and progesterone. So these are the classic female hormones that cause us to menstruate every month, shed that lining of our uterus, and mark that we are basically fertile or in that reproductive stage of life. Perimenopause is a transitional period from a normal menstrual period to no periods at all. So a woman who is heading into menopause, which is the period of time when the menstrual cycles cease for a woman, perimenopause can occur earlier on and start happening gradually up until a person reaches menopause. For myself, I had an interesting situation where in my late 30s, I was told by my gynecologist that I was already like perimenopausal and that I was going to have a bumpy ride with all of this. And then for myself, I went through there and all of a sudden, boom, no more menstruation. And there was hot flashes and it was terrible, but then I got through it. So then I was fine. And there are some cultural differences in what we see with symptoms of menopause. And we'll be taking a look at that in just a moment. So once again, menopause is that end of monthly ovulation and menstruation. It begins with perimenopause. There are all kinds of really fun stuff that women get to go through during this period of time. There's hot flashes, there's headaches, sleep disturbances, dizziness. Hey, I didn't get dizziness. Yay, I got to skip on one of those. And the timing is influenced by genetics. So basically, when a woman enters menopause can pretty much be somewhat predicted by when her mother went through menopause, because we know there is a genetic component to it. Culture can also impact the symptoms. Interestingly, in Japan, women there experience few hot flashes and don't have like the headaches as bad. Their symptoms are pretty much less than in Western cultures. One of the reasons for this is thought to be that they have a soybean-based diet. Soybean has natural estrogens in it. So the natural estrogens that are occurring in the soybeans may, to some degree, soften that blow of losing those estrogens that a person loses during menopause. People of African descent have the highest incidence of hot flashes and often have severe symptoms. Sometimes women have such severe symptoms from menopause that they may not be able to work, and they have some very serious complications in their life due to these symptoms. In some cases, these women can be placed on a particular type of hormone that would be a hormone replacement therapy. However, this type of therapy can increase the risk for stroke, heart attack, and breast cancer. So these types of hormone replacement therapies are only reserved for those that have super severe symptoms. In addition, it is not recommended for women over 60. There are many different reactions that women have to going through the process of menopause. Of course, there can be many individual differences. Some people are sad and depressed because they really stress that importance of childbearing and the loss of being able to bear children after menopause. However, in most cases, women who go through menopause, when they are expected to have like a lot of children throughout their life period, oftentimes they feel that menopause is a period of relief to them. As we mentioned in some previous lectures, sometimes menstruating women are restricted. They are asked to live on the outside of town where unclean things are done because they're considered to be unclean during this period of menstrual cycling, where they're not allowed to cook for their families. They're not allowed to be interacting with people, but interacting with their husband. So in many parts of the world, menopause is a very welcome change for people. There are a lot of cultural differences and individual differences. Men also go through some reproductive changes during middle adulthood. For example, men tend to have lower testosterone levels during this period of time. Their sperm quality and quantity also are impaired. So there will be less sperm and the quality of the sperm will be lower. For example, they may not swim so straight, kind of have a little hitch in their get along, maybe swim off to the side a little bit. Possible evolutionary reason for no male menopause. Well, men can reproduce up until their old age. As long as they can get the deed done, they can produce offspring. One of the interesting things that has been noted is that there is an increase in psychological issues and links to higher cancer risk for older fathers. So in other words, when we have a very old father providing the sperm for the child, there are sometimes some risk factors involved with that as well. Males may also experience erectile dysfunction. Erectile dysfunction is an inability to adequately achieve and maintain an erection that results in satisfactory sexual performance. About 22% of men over the age of 40 will experience erectile dysfunction. 75% of those who experience this disorder are experiencing it due to a physiological issue, so some type of physical thing. For example, an enlarged prostate. An enlarged prostate gland can result in erectile dysfunction. Interestingly, when it comes to health and disease and aging, what you can see from this graph is that as people age, going from 20 to 100 years old, what we will see is that people with a higher socioeconomic status enjoy a higher health state score. In other words, they report being and feeling healthier than people from a lower socioeconomic status. So our gold bar here is low income, and as you can see, across all ages, the lower income group is reporting a lower health state score. So they're reporting themselves feeling less healthy. Then we have our lower middle income, which is doing better than our lower income group, but not as well as our high income and upper middle income groups. So this graph is just to show you once again, there is a socioeconomic component to health and disease as we age. And that oftentimes when people have that higher socioeconomic status, they're reporting better health scores. During middle adulthood, we often start to see chronic disorders. Chronic disorders are disorders that have a slow onset and a long duration. In other words, they take a while to develop. These types of disorders are rare in early adulthood, but they increase during middle adulthood, and they are common in late adulthood. Some of the top chronic disorders in middle adulthood are arthritis and hypertension. Men are more likely to have fatal chronic disorders than women. Another health condition that is problematic in middle adulthood is cancer. Cancer is the leading cause of death for adults age 45 to 64, and it is responsible for 1/3 of the USA's midlife deaths. Prostate and breast cancer are the most common cancers, prostate for men, breast cancer for women. Genetics and environmental factors play a role here as well. Smoking increases the risk of both of these cancers, and family genetics also play a role. Treatments include chemotherapy, radiation therapy, surgeries, immunotherapies, and the best treatment is early detection. So the best way to prevent devastating cancer outcomes is to try to identify cancer early. In addition, living those healthy lifestyles of diet and exercise and trying to keep a healthy body weight, those things will also help reduce your risks of cancer as well. So once again, early detection is very important for cancer good outcomes. So this image that you're seeing here is a woman getting a mammogram. A mammogram. And that is one way to identify if there's any abnormalities in the breast. That's a screening tool for men. They can get a prostate exam, and they should start getting those after the age of 50 and possibly earlier, depending on the history of cancer for men and women, would start earlier screenings. On the slide here, it talks about risk stratification. What that means is that, say my mom and my grandmother both had breast cancer, I'm going to want to start my screenings earlier and more frequently than somebody who has not had any cancer in their family. Myself, I haven't had breast cancer in my family, so they're going to screen me every couple of years. I don't have to get screened annually. So that's what they mean by risk stratification. Cardiovascular disease is another one of those things that can kind of sneak up on you. And you start to see problems with this in middle adulthood with atherosclerosis. So that's the buildup of plaque in your arteries. All that fat and cholesterol and things that we've been eating and acquiring in our diet and not exercising, all of that is going to start causing us problems when we hit middle adulthood. If we take care of some of these issues in middle adulthood, it will help us have a better outcome for later adulthood. Heart attacks are blockages of the flow of blood to the heart, and 50% of people who have heart attacks die before receiving treatment. These things can be avoided by proper diet and exercise. Coronary heart disease is the second most common cause of death among midlife adults worldwide. The risk factors for coronary heart disease are high-fat diets, a very American thing to do, smoking, and a lack of activity. Stress is also a contributor. So by combining a lifestyle that includes just a little bit of exercise, like 20 minutes a day of exercise, and trying to eat a low-fat, healthy diet and not smoking, these things can really reduce your risk of heart disease. Coronary heart disease, once again, can be treated also. One of the things that they give people who are at risk for this disease is an aspirin daily. That's something that thins out the blood. And the protective factors, I can't say it enough times, exercise, a healthy weight, those things are very important to later health. I'm sure I probably sound like a broken record now on this screen, but there have been studies, and your book does point to a particular study by Valiant et al., that identified characteristics of midlife that predicted health outcomes 25 to 30 years later. Those habits would be smoking, being overweight, alcohol abuse. These things strongly predicted negative health outcomes, which means being sad, depressed, lack of mobility, and being sick. However, things that were predictors of positive outcomes were years of education, marriage stability, having a forgiving and forgiving personality, and sociability, in other words, being able to get along well with others. Those things lead to happiness and well-being in later years. Interestingly, education was also a predictive factor in this study. So that was kind of the most interesting thing. It wasn't just the positive outlook. We know that people with a personality that is confrontational and likes to argue, that type of thing, kind of high-strung, those people have a higher risk for heart disease than somebody that's more laid back. We're not going to get into the personality types and all. I just wanted to kind of throw that out there. But education, I thought, was an interesting predictive factor according to this particular study. Overall, the health has been improving of midlife adults worldwide, especially in developed countries. One of the exceptions are white Americans with low levels of education. Interestingly, we see that white Americans with low levels of education are having rising rates of mortality for this group. In other words, more of them are dying during midlife. They have kind of what they call deaths of despair, kind of the depression and things that go with being low income and having a difficult lifestyle. These things can lead to, for example, opioid overdoses. And we especially see this type of thing in rural areas. And we see this primarily in white Americans with lower levels of education. This graph is kind of interesting as well. It is labeled the crisis of American whites with low education. And basically what we're looking at this graph is we are looking at the deaths per 100,000 people. And we are looking at these deaths in relation to whether you are white, whether you are black, whether you are Hispanic, or whether you are white with a high school education or less. And what we see is that the Hispanic population, we're looking at approximately 400,000 deaths per 100,000 for middle adulthood here. And we see that from 2000 to 2010, we see this number declining. So the number of deaths during middle adulthood has dropped for that group. When we look at the number for blacks, if we look at the green line up here, they had the highest number of deaths during this period of life. However, what we see is, once again, this trend is moving downward. So it went from over 900 deaths per 100,000 people to down to about 700. So we saw a good decline there. What we see here for whites, which is this orange line, we see that whites, the death rates for this age group are climbing. And it is a gradual climb. We're looking at about what, 4,800 here, or 480 deaths, climbing up here to about 500 deaths. And the thing that the graph is about is this red line. This red line represents the white people with a high school education or less. And what we see is they have a high number of deaths, and they are on the rise. And a lot of this rise has to do with, for example, the opioid epidemic. The opioid epidemic tends to, we tend to lose a lot of less educated white people to that epidemic, which is one of the reasons why we're seeing this big rise. That's what they mean by deaths of despair when you're reading your book. As I mentioned previously, there is a connection to hostility and health. Expressed hostility, which is frequent angry outbursts, rudeness, contempt, just being disagreeable and basically somewhat irritable at all times, has a tendency to put you at higher risk for cardiovascular problems, health complaints, and overall illness. Also, these are unhealthy behaviors also. And this type of personality, oftentimes people with this temperament tend to smoke and drink also. So one of the important things that we've learned so far is that exercise is very important in middle adulthood. However, there are some difficulties and barriers to people exercising in middle adulthood. We have to try to weigh those barriers against the benefits of exercise. So the benefits of exercise are stress management, which reduces disease risk in itself. And some of those barriers are the time, energy, health, and convenience, and lack of facilities. Getting enough exercise in middle adulthood is kind of a vicious circle. Same thing with trying to eat healthy. It takes time and energy to prepare those meals that you need to eat a healthy diet, and it takes a little bit of time and energy to exercise. So until somebody develops the habits and gets into those routines, it makes it very difficult to properly exercise and eat a healthy diet. So the best bet is do it before you get to middle adulthood. So start good habits of exercising daily and eating healthy before you get so tired and into middle adulthood. Next, we're going to take a quick look at cognitive changes in middle adulthood. Now we're going to take a look at a couple of different types of intelligence: crystallized intelligence and fluid intelligence. Crystallized intelligence is an individual's accumulated information and verbal skills. So it is basically acquired skills, and it decreases through middle adulthood. So thank goodness, even when you're as old as I am, you can still learn new stuff, and you get to hold on to those skills that you have already acquired. Although from this video lecture, I don't know, I'm kind of questioning that right now. Fluid intelligence is the ability to reason quickly and think abstractly. It begins to decline in middle adulthood. Actually, research shows that you are actually at your best with fluid intelligence in your early 20s. So actually, you know, mid-20s, you're already on the downhill side of this one. And fluid intelligence would be having to think on the fly and being very quick. Now, the exception to this is if you have expertise. If you have expertise in a particular area, you will maintain your fluid intelligence in that area because you will have a good knowledge base and you'll be able to quickly reason and think throughout that area as well. However, basic processing skills, like if we were to be sitting myself and a younger person at a computer and we had to really quickly solve abstract problems, the younger person would most likely beat me unless it is an area that I am an expert in. Then I might still win. Anyway, so that's crystallized and fluid intelligence. This graph kind of gives us a nice visual representation of how fluid intelligence and crystallized intelligence changes over time. If we start in infancy, we don't have much of either. As we grow and develop all through late adulthood, we still are able to maintain and increase our crystallized intelligence, whereas our fluid intelligence starts dropping off a little bit during early adulthood. This is a graph from a previous book that I had used in the past, but I really like it. It talks about how these different abilities change over time. So these are longitudinal trends in mental abilities. Here we have from 25 to age 88, and these are the test scores on this side from like 30 to 65. And we will look at how most of these abilities tend to decline a little bit over time. But what we do see is that this verbal ability right here stays pretty steady and doesn't start dropping off until a bit later. However, our perceptual speed, that is that quick reaction time, we can see it really peaks up here in our early 20s, and then it drops off significantly by the time we are in our 80s. Our numeric ability also drops unless you are one of those math whizzes like my sister-in-law, whose numeric ability would still be way up here with the verbal ability. And once again, that's her area of expertise. So there are a lot of individual differences in this. These are just general trends. This slide just has a few more notes about information processing and perceptual speed. Once again, it declines in early adulthood, as we saw earlier, and it continues declining in middle age. Part of the reasons for this decline occur at different levels. For example, cognitively, we can lose, we have some information loss. It's kind of that use it or lose it principle. Information I haven't accessed or used for a while is going to be more difficult for me to recall and bring back up and process and use. And there are some neurological changes. There is a small amount of brain shrinkage that's going to occur. We're going to have some neural network loss. However, this can be compensated for by practice and experience. A lot of older people who are very sharp-minded say that they do crossword puzzles and other things, word puzzles, Sudoku, things to keep their mind sharp. And this type of compensation helps keep their processing speed up a little bit better. During middle adulthood, we see a little bit of change in our attention and memory, not a whole lot, but we do see some. When it comes to attention, we have a slight decline in selective attention and divided attention. This is not a huge issue, but it is an issue. We will see more changes in later adulthood. Now, selective attention is when we are trying to hone in on one thing, focus on that one thing, and not be distracted by other things. You'll see my problem with that sometimes when I'm getting distracted when I'm doing a video. Divided attention is when you're needing to do more than one thing at a time. This skill, this ability is beginning to lessen in middle adulthood, and this becomes a big problem in later adulthood. Not a large decline in memory tasks, however, there is some. Increases shown in factual and procedural knowledge, however. So the stuff we learn to do, we're not losing that. We can learn to do more stuff and recall more things. We are just having some mild declines. So don't worry too much about me. I'll be fine. The changes that we do see in memory are things like needing more time to learn new information. I'm not going to learn it as quickly as I did when I was younger. There's a decrease in working memory capacity. So maybe when I was able to manage and manipulate 7 pieces of information or 7 chunks of information in my working memory in my 30s, I may only be able to work with 5 pieces of information. So my workbench, my working memory capacity might be somewhat reduced. My long-term memory is less reliable, and this occurs because as we age and go through time, when we look back at our especially autobiographical memory, our memory about events and things that occurred in the past, we have a tendency to frame those memories in a way that fits our idea of who we are and frames us in the most positive light. Retrieval will also take longer, and you'll see that continually with my videos here, where I have to stop a minute and wait for that word to come. That has to do with a lack of sleep and my middle adulthood stage of life. And compensation is used more. So in other words, in middle adulthood, it may be important for us to use good memory strategies to help us compensate for these slight losses that we're seeing during middle adulthood. I'm just going to briefly mention job peaks and job losses. So job satisfaction has a tendency to peak in middle adulthood for people, especially who are professionals or have careers and that are college educated. More expertise and authority is usually enjoyed during the middle adulthood period. Acceptance of the profession, kind of being okay with where you are professionally. Dissatisfaction can also occur. So you can also have the other side of it. When dissatisfaction occurs, oftentimes people will pursue new challenges. There is a glass ceiling that is often hit for women where they are unable to go beyond a certain place, which we had a great breaker of a glass ceiling just occurred during the most recent election, where a woman became vice president. Regardless of your political affiliation, at least we can say, yay, a woman made it that high. And burnout is another problem. Oftentimes people in middle adulthood can experience burnout in their jobs, especially depending on what type of job and how stressful their job is. Involuntary unemployment can be disruptive. When somebody loses their job in middle adulthood, it is not quite as easy to get another job as it is for a younger person, because a company doesn't really want to invest in an older person oftentimes. Variability in employment among developed countries. We see these patterns differ from country to country, and we do have a globalized economy now. And in some situations, older, more experienced workers are still valued. We're now going to move on to social and emotional development. We've talked a lot about some of the things that are kind of a downer about middle adulthood, like some of the physical changes and things like that. However, during middle adulthood, there's oftentimes an enhanced sense of self-development. Self-acceptance is often more favorable during this period of life, where a person really kind of knows who they are by the time they reach middle adulthood. Identity development is high. You pretty much know who you are by this point in time. Increased autonomy. You feel like you're kind of a little bit more in charge of your own destiny. And collectivist cultures may emphasize relations to others more than self-development. So the self-development part of it and kind of knowing who you are, that's more of a Western themed idea, whereas having really good and positive relationship with others is more of a collectivist culture type of thing. The overall idea is that people are usually a little bit more okay with themselves by the time they reach middle adulthood. Coming back to our good friend Erik Erikson and his psychosocial theory, we can see that during middle adulthood, we are now in the period that he calls generativity versus stagnation. So if you are on the generativity side of this equation, that is a desire to leave a legacy to the next generation. It's a way to achieve a sense of immortality, focus on continuation and improvement of society. So it is a positive view of your aging, where you can say, okay, I have some knowledge, I have some wisdom, I want to pass this on to help the next generations. So that would be kind of the positive side, the generativity side of this equation. The other side of the coin is stagnation. That's a sense of self-absorption that develops when individuals feel they've done little or nothing for the next generation. Another way to view this is when somebody gets to this point of their life and they're looking back and they're saying, oh, if only I'd have done this, or if only I'd have done that. Well, by the time we reach middle adulthood, oftentimes we do have things we look back at, like, geesh, I wish I would have packed my kids up and moved to Alaska. Okay, but I didn't. But I'm not going to sit here and be sad about that. I mean, maybe a little tiny bit of bummed, but overall, I'm going to look back and say, look, I'm in this position now where I can actually give back. I can give back by teaching, by being a first responder, doing mental health care for people. There are ways that I can give back to society, which helps me to be on the generativity side instead of the stagnation side. I just included this slide because I thought it was cool. This is like a grandpa sitting here doing some type of artwork with a young one. So it says generativity can include teaching skills to the next generation. It looks like she's doing kind of a stained glass thing maybe. Looks pretty fun. For women, there has been a duality in status. Oftentimes women in a lot of parts of the world kind of have a lower status than men. And during the midlife period in many areas of the world, midlife means that that woman has an enhanced status. It is a decline in those restrictive gender roles. I mentioned earlier that in places like India, women gain position in the family and in religious matters, and they have similar increases in self-confidence in a wide variety of cultures. Cultures vary in women achieving status and authority, so the decline in attractiveness for midlife men is not usually seen. However, for women, that attractiveness can be seen. So once again, we do have that double standard. However, a lot of cultures, when a woman is in midlife, they do have an enhanced status. We talked in earlier chapters, especially during our adolescence chapter, about people having possible selves. For example, we talked about the feared self and the one that you don't want to fear, or the self that you want to become. We have different multiple selves as we go through time. And what happens as we age and we come into middle adulthood, we have fewer and more modest and concrete ideas of ourselves. So we may not fear so much becoming Aunt Sally or Uncle Bill or whoever it is. We have a more realistic view. We kind of know who we are and that we're not going to become this person just because we look like that person. And we have a tendency to view ourselves a little more realistically and in a little bit more of a positive light. We may become more time-oriented with age. So this idea of who you want to be and who you want to become as you move through life continues. Just because I'm in middle age doesn't mean that I look forward. I want to know, who am I going to be in my late adult life? How do I want that to be? I'm not going to say, oh, gee, I'm going to go back to medical school and do this and that. Not that I couldn't, but I mean, I'm not going to invest all this time doing certain things because I have to be realistic about the amount of time that I have left. So our ideas of our possible selves are narrowed because we know we are a little bit more limited on what we can do. We're a little bit more realistic, and we're actually a little bit more positive about those things as well. Once again, our self-perception in midlife tends to be complex, integrated. Our self-descriptions become more complicated because we know ourselves with a little bit more depth than we did when we were younger. These self-perceptions include feelings of accepting yourself, of autonomy, of environmental mastery. In other words, you are kind of the boss of your own environment by the time you hit middle age. I mean, you may still have to go to work, you may still have to work for somebody, but to a large degree, your life is kind of your own. This type of attitude and idea is linked to increased well-being and happiness. Also wanted to talk briefly about sexuality in middle adulthood. It's kind of interesting. I have heard students say, oh my gosh, they're 50 years old. How could they have sex anymore? Yeah, you can. When you're in your 50s, you can still have sex. Basically, sex can decline and sexuality can decline in middle adulthood. And women tend to be their most passionate in their 30s. Males tend to be their most passionate or have the most sexual desires, what I mean by that, in their 20s. However, couples can maintain a healthy and active sex life into later adulthood. Oftentimes, it would be less frequent, but higher quality. So don't worry, middle adulthood's not so bad. Continuing just a little bit more on this note to make you feel just a little bit uncomfortable, there are some cultural contrasts in these views of sexuality in middle adulthood. We covered a lot of different concepts and ideas of aging from different cultures in our first chapter. One of the ideas that we talked about was from India. And according to a developmental theory from India, the midlife stage is time to begin more spiritual pursuits. And in traditional culture in India, during the period of time when the son moves back into their home with their wife and have their first child, from that period on, the parents of the child that has moved back in and had a child with his wife, they're not supposed to have sex anymore. They're supposed to be worried about spiritual endeavors. And I don't know a lot about that culture. I'm just kind of going off of what your book says. And so that's kind of an interesting difference regarding sexuality. In the United States, sexuality enhances emotional intimacy and provides pleasure. So there's, different cultural views on sexuality during middle adulthood. Once again, the frequency depends on the gender and the partner. In other words, men have a tendency to have a higher sex drive than women. And hormonal changes may require assistance for both men and women. A man might need that little blue pill or whatever it is. A woman might need assistance with lubrication, things like that. There are just stuff that people may have to do to maintain a healthy sexual relationship in middle adulthood. And then oftentimes couples do not need any assistance with that in middle adulthood. And part of that has to do with that diet, exercise, all that good stuff as well. All right, moving on. Now that we've talked about sexuality, we're going to move to talking about marriage in midlife. Marriage satisfaction follows a U-shaped pattern, and I believe I have a graph for you to see after this. Satisfaction is basically, it starts off very high when you first get married. Then you kind of go to a low point while you're hitting all the turbulation and stuff, while you're getting to know each other better. And then it climbs again in later periods of the marriage. Some scholars disagree with this, but this seems to be the most mainstream idea. And once again, this is based on a Western idea. Most marriage partners have greater financial security, fewer stressors, and more leisure time. And as a person gets older, they have a tendency to move towards that compassionate love more. So this graph of marital satisfaction shows you up here is very enjoyable. Down below we have not the very best period. That's a great label. And then years married. And so what we see is that first 7 years, they talk about that 7-year blip here. You start off really high, and then it dips down, and then it goes back up in later periods of marriage. So when you hit about this 20-year period, the satisfaction starts going up. However, what you'll notice is that marital satisfaction with men has a tendency to be a lot higher than women. So men tend to enjoy marriage more than wives do. And I'm sure there's lots of reasons for that. I'll let you guys contemplate that one on your own. Now we're going to move on to relationships with adult children. Midlife parents have young adult or emerging adulthood children usually. Historic patterns in Asia, Africa, and South America is a married son and wife remain in the parent's household. So if I had a daughter, she would be expected to marry someone else and then go live in the home of her in-laws with her husband. If I have a son, my son is expected to bring his wife here with me and live in my home. An interesting pattern is that once they start having children, his wife would have more authority within the home. Unmarried, and we've talked about some of this, like during emerging adulthood, these different patterns of when adult children are living at home with their parents. Unmarried adult children at home tend to be welcomed in Southern Europe and Japan. And adult children leaving the home is both sad and a happy time in Northern Europe and the US. We've heard of those empty nesters, people who are kind of bummed out that their kids have grown up and moved away. However, it often opens another chapter for the married couple's life as well. And so these are just different patterns of relationships with adult children and living arrangements. A quick reminder was about 40% of American emerging adults return home after moving out. Parents often provide financial support even after children move out. And compatibility with children's partner is also important. It's important for the relationship between the adult children and the parent, for the parents to accept that child's partner, or that adult's partner. I briefly mentioned the empty nest. Here's the empty nest syndrome. The common belief that marital and family satisfaction decreases after the children leave the home. Satisfaction has a tendency to increase, researchers show, after adult children depart. So those parents can kind of reestablish that relationship with each other. And then there's revolving door syndrome. Adult children may return to their parents' home after completing education, while establishing a career, or during times of financial or marital difficulty. And that's just considered the revolving door, and being able to come in and out of the adult's home. In my house, that's always welcome. They're always trying to escape my home. I don't know. I say, come back. They try to leave. I don't know. Okay, we're almost done. We're almost wrapping it up, and let's move on to our next one. Another important part of middle adulthood for many people is becoming a grandparent. Grandparents' chores often can include childcare. Becoming a grandparent oftentimes involves childcare for the son or daughter's child. Involvement is influenced by distance and relationship with in-laws. So in other words, if you live close, you can be involved. Grandmothers tend to be more involved than grandfathers. Daughter-in-laws relationships are important. In other words, if you don't get along well with your daughter-in-law, you're not going to probably see your grandkids as much. And for the most part, becoming a grandparent is a role that most people enjoy. Now we're moving on to the midlife crisis. The midlife crisis is a term that was credited to Carl Jung. Levinson and Jung believed it was a time of and feeling of confusion and turmoil. However, more recent research has failed to find consistent evidence for a midlife crisis. Negative life events can occur, but not specific to middle adulthood. So although there was a couple of studies that seem to support the idea that people have some big midlife crisis, none of the contemporary research has supported that idea of a midlife crisis. So we'll call that myth busted. Another issue that people have to deal with in middle adulthood is having aging parents. So living elderly parents, 10% of adults in 1900 basically had living elderly parents. Whereas in the year 2000, about 50% of adults had living, aging, or elderly parents. More recent studies have shown that when a person enters midlife, approximately 41% have both parents alive. However, when exiting midlife, people tend to have no parents left alive. So 77% of people leaving middle adulthood do not have parents alive anymore. So our last slide is about middle adulthood being what's called the sandwich generation. So middle-aged adults often feel sandwiched between the competing needs of adult children and aging parents with limited support. So basically, your kids, you still worry about them when they're adults, so you have those worries, and you have the worries that go along with aging parents. Caring for elderly parents is often viewed as non-normative in the Western society. In Western society, people often feel unprepared for this role and torn between love and resentment for caring for elder adults. It can be stressful, but it can also lead to personal growth. It is mostly middle-aged daughters that end up doing the care of the elderly adults. Now, interestingly, I mentioned that caring for elderly parents is often viewed as non-normative. Well, that is in a Western culture. In Asian cultures, remember, part of becoming an adult is that ability to take care of your parents. In some Asian cultures, however, we are seeing them become a little bit more westernized. But for the most part, being collectivist societies, Asian cultures often very much value caring for their elderly adults, and it is expected. It is not non-normative. Anyway, that will do it for this particular presentation. I hope you get some use out of this, and I wish you a lovely rest of your day. Bye-bye.